Dr. Damian is in the house this morning, and we're going to be talking about contraception. Who should go for it? Of course, it's great to have you, Dr. Damian. You are welcome. Contraception.
Thank you.
You know, just before we got up and said, we're having a very interesting discourse with Mazino, and I asked male contraception, female contraception, but mostly contraception is always mostly about the women.
Yeah.
You know, and people don't know about male contraceptives. You know, but let's talk about the concept of contraception first, for those who might not understand what contraception is.
So contraception basically means pregnancy prevention. So any strategy that you deploy to prevent pregnancy is...
When you say strategy, oh God, Master is just smiling, Master just smiling behind. This is, okay, this is easy. Okay, let's go. Strategy, okay. So there are different kinds of strategies, right?
Obviously.
Okay, so what kind of strategies can one employ when it comes to contraception?
All right, so, I mean, there are natural methods for preventing pregnancy, and there are the artificial methods as well.
Okay.
You know, when you talk about the natural methods, these are methods that, you know, basically depend on natural biological events to prevent pregnancy. So we're talking about withdrawal method here, you know, which is very common, especially in our setting. We're talking about lactational amenorrhea. This is a method that relies predominantly on breastfeeding. So what happens there is when a woman puts to bed and she is breastfeeding a baby, particularly if she's doing exclusive breastfeeding, you know, there are hormones that she secretes. These hormones help to block ovulation from happening. Without ovulation, of course, natural contraception will not be able to hold. So that's one. There's also what we call the calendar method. So essentially, the woman tries to know when she's ovulating. You know, there's what we call fertile window, an interval of 6 days during which a woman is most fertile and has the highest chance of conceiving. If she knows or she can predict those 6 days, she only has to just avoid sex during those 6 days.
That period.
So that's the calendar method. There's also the Billings Method, which essentially involves the woman noticing her cervical mucus. Cervical mucus is the discharge that the woman notices when she's fertile. You know, there is its consistency is a bit different from all. So if she has monitored the cervical mucus for a long period of time and she's able to tell the particular consistency of the mucus during ovulation, she can avoid pregnancy, I mean, or sex around that time and avoid pregnancy. So these are like the natural methods that we have. And then you have the artificial methods. So under artificial methods, there are, you know, hormonal and non-hormonal. Okay. The non-hormonal, first of all, you have the condom. So that's where the man comes into the picture. However, there is also a female condom.
Female condom, yes,
you know,
as we know.
Most people don't know about that, but there is a female condom. So you have the male condom, you have the female condom. The couple can decide to use that. However, I mean, for some funny reasons, they don't like. Couples don't, you know, naturally, you know, prefer condoms because of reduced sexual pleasure. Sometimes people can have condom allergy. So that's one. You can also have what we call the Copati Iud. So it's an intrauterine device. So it's a non-hormonal contraceptive. So I mean, the woman can insert it in her womb by a trained professional, and it can provide contraceptive cover for up to 10 years.
10 years?
Yes, for up to 10 years. But of course, I mean, like I usually tell people, there is no contraceptive without potential side effects. So it's always important for the couple to be duly aware of some of these potential side effects. So I talked about condoms. I've talked about the Copati Iud. So after that, you are now looking at the other options as well, like the cervical cap, diaphragm. Those are all barrier methods, essentially. The woman wears something inside, covers the cervix, so that it serves as a barrier between the vagina and the upper female genital tract. That's what. Then you go to the hormonal options or methods. Under hormonal options, this basically involves the use of hormone-based preparations.
Okay.
So, you know, basically to prevent pregnancy, prevent ovulation from happening, and by extension, pregnancy is prevented. And these hormone preparations can come in various formats. You have the pills. So there are the oral-based contraceptive, the oral contraceptive pills. There are the patches that somebody can just, place on their skin. There are implants that the person can have inserted under the skin. There are intrauterine systems where the woman has it inserted inside of her womb. Okay, so it depends now, making the choice of which of them to go for
use. Now,
actually depends on the person's expectations. And this is an area where having to see a doctor is very important. Okay, because some people just base that decision solely on what they have heard from their
prior
parents,
experience from somebody else and all of that.
I have said this before on a different platform, that what is best for someone might not necessarily be the best option for you. So there is always that relativity at play here. So it's important you go to your doctor, offer your contraceptive expectations, and doctor will now go through that process of selecting the best one for you.
And that might also include checking your medical history to know what is...
Exactly, because, there are certain contraceptives, hormonal contraceptives now, that are not suitable for certain medical conditions. For example, a woman who has a family history of, say, genital cancer, let's even say cervical cancer or even vulvar cancer, there are certain contraceptives that are not ideal for her. A woman who is breastfeeding, for example, there are certain contraceptives that will not be ideal for her. Now,
talking about breastfeeding, you mentioned about when a woman is lactating, and as at that time she can't ovulate or might not ovulate. Is that a general? Is that a blanket? Does it happen to everybody? Because I think it doesn't happen to everybody.
It's one of the reasons we say that some of the natural methods you cannot rely 100% on them. Okay, because people differ. There are some women who the lactational amenorrhea method works perfectly for them. In fact, it can be so amazing that as long as they are breastfeeding, they don't ovulate. They don't ovulate, but immediately they stop, their menses come and they start releasing eggs.
You know what I pick, the most important thing, what I pick from this is that, look, we are unique as we are, and for you go talk to a doctor, find what works for you. As a person, as male or as female. Thank you so much, doctor. It's always enlightening talking to you anytime on this show. All right, that's it. I hope you're able to pick one or two things on how to go around contraception for either male or female. Now, let's head over to the kitchen. What's up this morning? I saw some tiger knot there. Tiger knot, contraception, they don't go. Don't mind me. Titi?